Hello friends of TV Agro, we are today in the veterinary specialty clinic of the country. We are going to talk a little about minimally invasive surgery. To begin with, minimally invasive surgery is an innovative technique. Here in Colombia, we have been performing minimally invasive surgery for about 6 years. Minimally invasive surgery is basically the traditional surgery, but with some additional advantages, such as the patient's recovery. One of the most common surgeries is sterilization in females. Normally sterilization is a surgery that is done routinely. It is traditional and is done by the open way, which is to make a laparotomy. In this laparotomy, all the viscera are manipulated with the hands, some sutures are placed, some cuts are made, an incision is left, which is usually a wide incision depending on the size of the patient, and this means that the patient will have a slightly large incision in the abdomen. It also means that the patient's recovery will be a little more painful. The patient will also have internal sutures. We will manipulate all the abdominal viscera to be able to perform this surgery. On the other hand, when we perform minimally invasive surgeries, it is a surgery that we perform through the insertion of a trocar. We make 2 incisions. Each incision is half a centimeter, and through there we enter with a lens, which allows us to visualize. We can make a diagnosis. We can visualize the whole abdomen without the need to manipulate it with our hands. We enter. We identify the structures we are going to remove, as in this case would be the ovaries, and we remove them by using ultrasonic coagulation equipment. This equipment allows us to cut and coagulate without having to put any type of sutures. We are going to make a much cleaner, much faster and much safer procedure. After that, the patient is going to recover much easier. The patient will be left with 2 incisions where he will only have a puncture. It is unlikely that the patient will have complications in these points, and his recovery will be faster, the pain will be much less, and the advantages are that we do this surgery on an outpatient basis. We do it in the morning, and 2 hours after the procedure the patient goes home perfectly to eat. We will not have any type of post-surgical complication. Another surgery, which is quite frequent and where we see the advantages of minimally invasive surgery, is in patients who have a retained testicle in the abdomen. These patients are normally called cryptorchid. They are patients who in their development could not carry one of those testicles. In many cases the 2 testicles, they could not reach the scrotum, they were trapped in the abdomen. This surgery is usually a little complicated because you have to make a large incision in the abdomen to be able to find where they were trapped. To do it by traditional surgery, which is to make a wide incision, put some separators, put some gauze, put some instruments until we can identify the testicles. It is going to be much more complicated. We can solve this type of pathologies very easily with the help of minimally invasive surgery. Again, we put 2 trocars. 1 trocar is used to enter a lens. With this lens we will be able to check the whole abdomen. Second, we enter a clamp through the other orifice. Through the second trocar, we enter a lens to check the whole abdomen. What is strictly necessary, and we can somehow find much more easily and quickly a retained testicle or the 2 retained testicles, and later we can remove them with the help of an ultrasonic coagulation device, which will also coagulate, and we can do it much easier. The patient will be left with an incision of half a centimeter, and the second incision, which is where the testicle comes out, will be the same size as the testicle. The surgery will be the same. We will close with only 1 or maybe 2 stitches. The patient's recovery is immediate, little pain. The anesthesia is normally short, and the manipulation of the patient's abdomen is also quite small, and we do not leave any type of structures inside the abdomen, which many times the sutures can generate a reaction. These reactions do not generate a post-surgical complication where we would have to re-intervene. With the use of the minimally invasive, the casuistry of re-intervention is quite low. Another pathology that we can avoid thanks to minimally invasive surgery is gastric torsion dilatation or gastric volvulus dilatation. This pathology is one of the most serious emergencies in the small animal clinic. It is a disease that usually occurs in large breed dogs and deep thorax. It is a multifactorial disease. It can influence it so that it can develop.
Nosotros podemos hacer fácilmente una técnica quirúrgica que se llama gastropexia.
This gastropexy can also be done by traditional surgery, but to do a gastropexy by traditional surgery, you would have to make a wide incision in the abdomen, a very large manipulation of the viscera, and thus avoid that suddenly that patient is going to suffer from a gastric dilatation and torsion. These patients that are usually of large breeds, leaving a very large incision in the abdomen is also a complication. It can be a factor that can lead to a post-surgical complication. We have this minimally invasive surgery. The gastropexy also with an incision of 0.5 centimeter to enter a trocar, which allows us to visualize. And another incision of 0.5 centimeter to enter a trocar. This surgery is going to avoid that our patients who are of large size, who suddenly are predisposed to this disease suffer an emergency of these. In the case that these patients have an emergency, the complication is quite high. With this surgery we can avoid it. Another type of surgery or cases that we can also solve in a simple way, is the ovarian remnant. The ovarian remnant syndrome, patients that are operated in different clinics that may have a complication, many times an ovarian fragment may remain inside the abdomen. This fragment of the ovary inside the abdomen will cause the patient to present recurrent estrus. It can be easily identified because the patient will present estrus again. If she is well sterilized, it should not happen. This surgery is also very complicated to do it by traditional laparotomy. A laparotomy implies that we make a wide incision in the abdomen, we enter, and we would have to deepen the abdomen a lot to be able to reach the place where these ovarian remnants remain. It is quite complicated, a surgery like this, and more in large-sized dogs. We can do this without a post-surgical complication, and the recovery will be much easier, and we will have the full certainty that we remove the complete ovary, the ovarian remnant. Since the lens that we use generates more or less 30% bigger the whole objective that we put inside this lens. To finish, I wanted to tell you how we came to implement this type of surgery here in Bogota. These surgeries in Colombia are really very few professionals who perform them. In Bogota we are a team called the INVASIVE. We do our surgeries, and we do them in several clinics in Bogota, and in Medellin in another university are also doing them. We are like the only two centers. How we got to this? We saw the need. Many owners also from the medical area asked us if we could do certain types of procedures in a minimally invasive way, and we had no answer because it was a topic that 5 or 6 years ago was not known. We began to investigate, we went to many courses, and from there we began to operate on patients. Important things, for people who are soon interested in the subject, it is basic to have the necessary equipment, the necessary instruments. It is basic to have traditional surgical experience, a lot of experience before starting to do laparoscopy, and to recognize when to use laparoscopy and when not to use it. Normally laparoscopy is a programmed surgery. It is not an emergency surgery, and laparoscopy must be performed with the same standards as traditional surgery, in terms of asepsis, instruments, anesthesiology, everything in the same proportion, and also to know the risks of this type of surgery. This type of surgery has risks, because we use a gas that goes inside the abdomen to be able to operate the trocars more easily. They are trocars that have a tip that can be sharpened, and they have to be handled very carefully, and the most important thing is that we have the equipment, the necessary instruments for each procedure, and we have the experience to be able to do it. that is a good combination. If we do not have the experience, it will be a little complicated. We will have many post-surgical complications. We do not only perform abdominal surgery, laparoscopy, we also perform thoracoscopy. These are much more complicated procedures, the risk is much higher, but the benefits are also very great. We have performed surgeries such as pericardiotomy, we have performed lung biopsies, mediastinal biopsies and pericardial biopsies, we have removed masses. These are surgeries that the patient is very grateful for, because we do not have to make a thoracotomy, which is gigantic, but we simply enter through the intercostal spaces with incisions of 0.5 centimeter, which are really very easy to close, and the patient will also recover very easily. Minimally invasive is a technique that can be applied in different areas, as well as in the thoracic part as in the abdominal part. Well, friends of TV Agro, today we are here from the Clinic of Veterinary Specialties of the country. We are the team of Minimally Invasive Surgery INVASIVE, and my name is Andres Chavez, veterinary doctor from La Salle University.